My name is Scott Pinion, and my title is a Special Procedures Cath Lab Tech. I'm a radiologic technologist is my background, so my role here is to assist the doctors in the Cath Lab with diagnostic and interventional cardiac procedures, and especially what we call STEMI procedures, which stands for ST elevated myocardial infarction, which is what most people refer to as a heart attack. So when I had a heart attack 5 years ago, I was halfway through X-ray school. I was re-educating myself. Spent most of my life working in telecom and computers, and I was re-educating myself to get into healthcare. And it was really a different kind of heart attack than what most people experience. I'd had a nice little bike ride that day, about 10 miles or so, nothing terribly strenuous. I've always been a very athletic kind of guy, outdoors kind of person, and I didn't really have the same symptoms most people have. Most people have, symptoms of pain or maybe arm pain, jaw pain, neck pain, chest pain, that kind of thing. Myself, I was just experiencing some unusual rhythms. As a matter of fact, I consider myself very lucky that I kind of understood a little more about what was going on with me, because otherwise I probably would have been too late getting to the ER. So I came on over to the ER because I was doing a lot of my clinic work here at St. Francis, and I knew that the Cath Lab here had just exceptionally fast response times for heart attack patients. So I came on in. Matter of fact, I stood in the waiting room just having a hard time believing that I was actually having a heart attack. And I almost waited too late, because by the time I told the person at the desk I was having a heart attack, that's when the chest pain hit me. And a few moments later, I was in ventricular fibrillation, or VF we call it, and unconscious, and really don't remember exactly what happened between then and the next day or so. But as the history got filled in for me, the ER just jumped on my case, took care of me, got me prepped, got the Cath Lab team paged to come in, because this is on a Sunday afternoon. So got the doctors on the way in while they're prepping me, and they had to shock me a few times, had to intubate me a few times. Not a few times, had to intubate me. They breathed for me, so I was not in the best of shape. Like I said, I was very lucky. Had I waited 5 more minutes, I would have been sitting outside in my vehicle doing this with no one there to take care of me. So they got me in the Cath Lab. They found the problem with my heart, which happened to be an artery called the left anterior descending artery, the LAD we refer to it as. Had a small plaque in it that had ruptured. Actually, my arteries looked pretty good, except for this little plaque that ruptured and clotted off a huge artery that kind of feeds a significant part of the heart, which is what caused the heart attack. So we got that opened, got blood flow restored, got a stent in place, and then they started a recovery process with me in the CCU for a couple of days, and then over on our telemetry floor for a few more days. Because I had taken a pretty significant amount of damage to my heart, I was here longer than some heart attack victims. So, as far as previous cardiac issues prior to this incident, that's what was so surprising about this heart attack for me, is that no, I didn't. I'm a big guy, but I'm really kind of fit, and pretty active. I've never had any trouble. I've been an athlete most of my life. Never had anything like this. And as a matter of fact, my coronary arteries that feed the heart muscle, they look really very good. Beautiful. It was this one small plaque that ruptured that caused this issue, so there was no warning whatsoever. This is the kind of heart attack that some people refer to as a widowmaker heart attack, because a lot of times they hit people so quickly, and sometimes without symptoms, that you don't have time to get to a hospital. I'm just very lucky that I kind of knew something was going on with my heart. I didn't know what exactly. So that's kind of how that happened. Everybody kind of worked on me a little bit when I was here, because I was here for, I think it was, if I remember right, it was 6 days total. So from the time I hit the ER waiting room, the ER took care of me, the Cath Lab took care of me. Cath Lab, once they had opened up the artery that was causing the heart attack and kind of got me stabilized, they moved me to our coronary care unit, which is upstairs, because I had taken a good bit of damage, and my heart wasn't ejecting as much as it was prior to the heart attack because of the damage. So the coronary care unit, CCU, took care of me for 2 days, I think it was, 2 or 3. And then they moved me to our telemetry floor once I stabilized even more, which is our where we take most of our patients that are not quite as critical, and they monitor me there constantly as well, but it's just a little bit different level. So those are the main departments that were able to look out for me. You know, this is an interesting thing about the staff here. It's the staff here, the doctors, the physicians, all the physicians, the nurses, the techs, everyone kind of they make St. Francis really what it is. It's gosh, it's kind of hard to describe. You know, for me, it's special for me because I now work with these people. I work in the Cath Lab that saved my life. I work with the people that saved my life. So you can see I'm pretty partial, but you know, it's the other things. Like the reason why I came to this Cath Lab, because I knew that this Cath Lab has exceptionally fast response times to heart attacks. You know, I kind of knew that coming in, and so I knew the care was going to be amazing. Matter of fact, I was doing all my clinical work as an X-ray student here, or most of my clinical work here, and was already kind of in love with St. Francis Hospital anyway. The staff was so amazing, but it's different. Like the emergency department, they have their own personality because of the nature of what they do. The Cath Lab, very similar because the nature is very, they're very similar what they do in that they're very emergent cases usually. And then, the coronary care unit, just a different level, very close contact with the nurse, with the one or two nurses that were with me the whole time. That kind of thing. So you get to know these people really well. Matter of fact, I go talk to them on a regular basis, And then when I got to our telemetry floor, the couple of nurses that specifically took care of me those days, I get to talk to them regularly too. And the care was it's just hard to describe. It was so amazing. You feel like a family in a way. And that's kind of something we shoot for, even on our Cath Lab every day. We want to make our patients, we don't want our patients to feel like a number. We don't want them to feel like a procedure. We want them to feel like family. Another important part of my recovery, I think, was as soon as I was capable, after I got to the hospital and I got a little stronger, I went to a cardiac rehab at the Millennium campus at St. Francis. Healthy Self, I believe is what we call it. And that's just such a huge part of the recovery because there's a lot of things that go on emotionally with you after you've had that close a call with death or any kind of a heart attack. Even if your heart attack was kind of controlled and everything was okay, you still have this emotional response to it because in the back of your head you're constantly wondering, wow, is this going to happen again? Is it going to happen in my sleep? What can I expect? And the folks at our cardiac rehab are amazing because what they do is they give you an environment where, number one, you can learn a lot about nutrition if you don't already know this stuff. You can learn a lot about exercise and what you're capable, what you can do, and what you're capable of doing. And the whole time they're monitoring you. So they have a great workout facility, hooked me up to EKG so that they're monitoring me the whole time. And we start out very slow. Even though I had been a strong cyclist prior to this, after the heart attack, I was very weak. It was really a couple of months before my strength really started coming back the way I wanted it to. So those initial workouts were kind of scary, and it was amazing to have them look out for me. And they really helped me find my baseline, where to start from, and then how to rebuild. And the rebuilding, at that point, I was confident in rebuilding, and it happened very quickly. I got back on the bike, and I was back to riding a few thousand miles a year. I'm not like a Tour de France rider or anything, but I get a couple of thousand a year or so. And I attribute most of that to our cardiac rehab folks. They were just awesome. Now, the follow-up care to the heart attack I had has been exceptional. It's just, it's hard to even explain. Let's see, I had the heart attack, it's 2015, I had the heart attack 6 years ago. Upstate Cardiology has followed me very closely, taking great care of me. My Cath Lab co-workers look out for me every day too, even though I've been very lucky and have had no problems since, but they still look out for me. As far as the additional care that I've had, because of the heart attack and I sustained some damage to my left ventricle, my heart doesn't eject as much blood from the left ventricle as it once did. Matter of fact, it was kind of cut about in half. That means I'm at a slight, or not slight, but I'm at an increased risk for something called sudden cardiac death, which means I could accidentally just slip into a really bad rhythm and my heart wouldn't be able to recover from it. So I have a device here now called it's a defibrillator. It's similar to a pacemaker, feels like a pacemaker. Kind of the procedure is very similar, but essentially it watches my heart rhythm and rate constantly. And if I were to go into ventricular fibrillation again, then it would attempt to defibrillate me. So, and I feel quite confident it would work, especially as many patients as I've seen us have to defibrillate and how quickly that therapy does its job. So the follow-up care is it's amazing. I go see upstate cardiology. I see Dr. Bittrick specifically, and I see them at least a couple of times a year now. We do a cardiac echo to keep a check on how much blood my heart's ejecting, make sure I'm still doing strong there. To me, the main thing is I'm extremely active, so I got back on the bike just as soon as they would let me, and work diligently to keep my heart strong, because that's extremely important when you have a reduced ejection fraction, is what we call that. And I can't say enough about the care from upstate cardiology, especially. The people there, the doctors, the staff at all the offices. It's interesting. I think I've been to all the offices now at different times, but all the staff there is just amazing, and they're just a part of the St. Francis family as well, as far as I'm concerned. You just can't get better care. Life after a heart attack, as I mentioned earlier, it's different. You have a lot of emotional things you go through where you've got to kind of get used to what you can do and how you can do it, and rebuilding to get back as strong as you were, if not stronger. I see patients every day who can be stronger than they were prior to their heart attack, as long as they're committed to it. So the things I've gone through and learned from that is that, number one, I got back. Actually, I'm probably a stronger cyclist than I was prior to my heart attack, even though my heart was ejecting a whole lot more blood prior to that. I'm probably a stronger cyclist now than I was then. The emotional things you go through is, I think, that you appreciate life even more. You appreciate every day even more. I'm sure I have bad days still, but most days I'm just kind of happy to still be here. And that varies a lot from person to person, So I thought I was that person prior to the heart attack, and I feel like I was a very positive person and always appreciated life. But this just increased that feeling for me, which in a way is kind of like a gift.